Dr. Ferguson coming to you from the Passioncam. On our last Passioncam, we started talking a little bit about first aid, some real basic things that everybody should know and be able to do. I thought we would continue that. It's such an important topic that a lot of people don't know a lot about. One of the things we were talking about, applying pressure. We talked about some basic things. Keep your cool, apply direct pressure, and ice can work on just about everything. Now, when we talk about applying pressure, let's talk about the tourniquet effect. Well, the tourniquet for most people is not going to be the appropriate thing to apply. In order to properly apply the tourniquet, you have to be certain millimeters above what that person's blood pressure is in order for it to be applied appropriately. And then you have to take it down intermittently so that you don't cause tissue damage underneath where the tourniquet is. So for the average person, a tourniquet is not going to be the way to go, and it many times may cause more damage than it did help. So if you don't know how to apply a tourniquet properly, if you have not been instructed on that, I would suggest that you try not to apply a tourniquet, but just apply direct pressure to whatever that area of injury is. Another really basic things, if you feel like somebody's injured, try not to move them. Try to keep their head as still as possible. Try not to move their head. That's a real important thing. If they're thrashing around and you think they may be injured, then you want to try to get them to calm down, to stop moving around, because they may, if they've really injured their neck, initially they may be able to move okay. But if they thrash around and cause additional injury, well, they may become paralyzed. So you want to have a cool head, try to get the person to be still, stabilize their neck, maybe put their head in between your knees if you don't have anything else, and kind of sit there holding them and talking to them. So at least their neck's not flopping all around the place, which can lead to more injury. So that's real important to try to get the patient calmed down. Along that same line, if you have a certain area that's injured, then putting a splint to that would be the next appropriate thing. But I think we'll talk about that next time. So Dr. Ferguson coming to you from the Passioncam. Be blessed and have a wonderful day. Bye-bye.